Hi, I'm Jay Norix, and I'm the developer of Parts and Memory Therapy. Today we're going to work with Dr. Ziai to see if we can reduce or eliminate her experience today with migraine headaches. Dr. Ziai,
Hi.
the first thing we want to do is define the problem using this approach. That's simple. It's migraine headache. The second step will be to find the part that carries a problem. 3 would be to collect the memories that are the foundation for the problem, and number 4 would be to neutralize those memories. And the result should be reduction or elimination of your symptoms.
Okay, sounds good.
So, what are you feeling? 0 to 10, and the amount of pain you're feeling?
About 2 or 3.
Okay.
So the headache started about a week ago, and once I feel it coming on, I have to take ibuprofen, because if I don't, it intensifies and it becomes a 10 within a very short period of time. And I start having nausea and vomiting, and I end up in the emergency room as a result.
Where in your head do you feel the pain?
It's in the back of my head, at the crown of my head, and it's pressure,
Okay.
It's pressure right now. When it gets very severe, it's severe pressure and throbbing, but right now it's pressure around my head.
So let's just go with that pressure. We've defined the problem. The problem is migraine. Now let's see if we can find the part of you, the subpersonality, that carries the problem. So focus on that pressure. That's the symptom you mentioned, the pressure, and especially the back and the crown of your head. Speak to that pressure and ask the part who carries the pressure to, or who feels it, to show herself or himself.
Please show yourself the part that causes the headache. Okay,
You have an image coming up?
I do.
Would you describe it, please?
Yeah, it's at my grandmother's house. We used to live there for a while when I was in high school, and I had exams coming up. So in the morning, I would feel very nervous and have vomiting. So I would vomit. That's how nervous I was. So I see myself over the sink, gagging.
Okay, so speak to that girl, the high school girl who's vomiting, and ask her to bring her boss in, her manager,
Okay.
the one who's your age. And what do you see now?
Myself, the same clothing now, with the same haircut.
Okay, so this sometimes happens. If there isn't a previous representation already present, then it's frequent that the inside part simply takes on the appearance of the patient as she is now. So she looks exactly like you right now.
Yes.
Is she conscious of everything that goes on in your life? Or is she capable of knowing that?
Yes.
All right. So what we need from her is to know about her very earliest disturbing memory of any kind.
My parents fighting in the car.
How old were you?
Probably 7, 8.
7 or 8. And can you see that little girl in the car?
No, I can't.
All right. So this is the memory that we were looking for. So we started off, we defined the problem, we found the part, and now we're going to heal the memory. So say hello to the little girl in the car.
Hello?
Ask her if she knows who you are.
No.
She doesn't know. Then explain to her that you are her grown up.
She says okay.
All right. But we want her to rate how disturbing this experience of listening to her parents fight is. 0 to 10.
It's an 8.
It's an 8. All right. Ask her, what is the feeling? What is the emotion? I would guess that fear is one of them.
It is.
Okay. Any other emotions that you can identify?
Sadness.
Sadness. All right. So let's work first on the fear. Now we use a fantasy to overwrite the existing information in the memory circuit. And so we can use wind to blow away her fear, water to wash it away. We can use a toilet to flush it away. We can use a fire to burn it up, dynamite to blow it up. What would you like to use to help your young self let go of her
Wind.
fear?
Wind.
Okay? Then please ask her to focus on where she feels her fear within her
In her stomach.
stomach. Then tell her, and please do this out loud, tell her to feel the wind blowing over, around, and through her, changing that fear into dust and blowing it away forever.
Okay. Hold my hand and close your eyes and let the wind blow away your feeling of scared and sadness and anxiety and hopelessness. I'm going to take her outside the car. It's hard to concentrate in the car.
Okay. Before you do that, when we get this kind of interference, sometimes one of the managers may be blocking. Please go back to that image of yourself that you found and ask her permission to heal this memory. This memory is a part of her set of memories, so she's the boss. Ask her permission to heal the little girl.
Yes.
Then try it again.
Okay.
And now ask the little girl, 0 to 10, how disturbed is she by parents fighting?
Maybe a 1 or 2.
All right. Ask her if she knows why it's that and not a 0.
Because she knows it's going to happen again.
Okay. She's concerned with the future, so let's make that the target of another wind intervention. Ask her to focus on where she feels that anxiety that it will happen again and blow it away.
Okay.
And now 0 to 10, what is it?
It's a 0.
All right. So since we've got this little girl here, ask her if she is aware of other times that this has happened. Parents arguing.
Not that, but so she sees her mom in the hospital after giving birth to another child, and she doesn't like being there.
0 to 10, how much does this memory bother her?
Maybe a 4 or 5.
4 or 5. So let's do what you did before. See if you can heal her of her distress.
Let's use wind to take the feeling of anxiety away.
And now where is she? 0 to 10?
It's 0.
0. Then tell her good job.
Okay.
And ask her if she has any other disturbing memories.
It was when she was older and her sister, we had visitors at home and her sister got presents that she didn't. She was very upset about it.
And what age was she then?
Probably about 8.
About 8.
Or 9.
8 or 9. She was very upset. So what would the emotion be?
Unfairly treated, not liked,
Okay.
not as important.
And how disturbing is that, 0 to 10?
She was crying, so she was very upset at 10.
All right. And is she ready to let go of that upset?
Yeah.
Then guide her as you did before.
Let's have the wind blow and take away your sadness and the feelings that make you upset.
You're nodding your head. Does that mean?
It's about a 1 or 2.
Okay. And does she know why it's a 1 or a 2 and not a 0?
No.
Okay. So in cases like this, I like to use a little special intervention when the stuck in the memory part doesn't know what it's about. And so we just blast her with the hurricane wind for 5 seconds. And so I'll work with you on this. Ask her to grab and hang tight onto something.
Okay, grab and hang on to the table
This is so the wind won't blow her away.
so the wind doesn't blow you.
And then I'm going to ask you to imagine a 100-mile-per-hour hurricane blowing through her, carrying the remainder of her feelings of sadness and not as important and feeling unfairly treated. Blow those feelings away. When I say go, you start the wind and I'll count 5 seconds. Ready?
Okay, ready.
Go. 1, 2, 3, 4, 5. And now check her. Did that take care of the rest of her negative emotions?
Yeah, she's smiling now.
She's smiling, so it's at a 0.
Yeah.
Good. Well, she's being productive. She's giving us a lot of information here, a lot of memories to heal. Does she have any other memories that she would like to heal?
Right now, just happy memories.
They're all happy. Well, we don't need to touch those. All right, then thank her very much. Tell her have a good time.
Thank you. Have a good time.
And now, go back to the freestanding part, the one that looks exactly like you. Thank her for letting us do that.
Thank you for letting us do that.
And what I think that we should do is to work on that memory that popped up
Okay.
when we first started.
Okay.
Is that okay?
Sure.
And would you ask the one who's your age for permission to work with that high schooler who's vomiting in the sink?
She says yes.
Okay. Then let's go to that scene and explain to her who you are if she doesn't already know. Does she know who you are? She knows that you're her.
Correct.
So ask her if she'd like to give up those bad feelings.
Yes.
And then ask her to rate how much they bother her, 0 to 10.
It's a 10.
It's a 10. All right. And if your wind intervention feels like the right thing to do,
Yes.
then tell her what you're going to do and carry it out by visualizing it.
Okay, I'm going to take you to the backyard, hold your hand, and then we can have the wind blow away your feeling of anxiety and nausea. Can we do the strong wind?
Yes. All right, then tell her to grab on tight so the wind doesn't blow her away.
Okay.
And then we're going to use 5 seconds of hurricane wind.
Just a second. Trying to find something to hold.
You can create a concrete post stuck in the ground.
Okay. Okay.
Ask her to focus on her distress, all of those feelings, and go. 1, 2, 3, 4, 5. And did that hurricane carry away all of her negative emotions and body sensations?
She thinks so.
Not sure?
Not sure.
Not sure. All right. Ask her just to check her body from head to toe and see if she finds any remaining elements of anxiety.
Yeah, it's in her stomach.
She does have some right there. So that should be gone, and it isn't. So that tells us there's a blocker. Let's go back again and ask your present time self for permission to complete this intervention.
Yes.
All right. We should have asked her permission before we started. Managers are kind of fussy that way. So try it again. We're going to use just 3 seconds of hurricane wind this time. There's only a little bit left. Ask her to grab hold.
She is.
Go. 1, 2, 3. And did that wind blow the rest of her bad feelings away?
Yes.
She
No,
does.
she's fine.
She's fine. All right, good. And since we've got her here, let's ask her if she has other disturbing memories.
No.
Okay.
I think she's just tired.
Okay. Well, then let's take away her tiredness before we leave. So ask her to focus on where she feels the tiredness in her body.
The back of the neck and head.
Okay. And let's see if you can blow that away. She's not tired anymore?
No, just relax.
She's relaxed. Good. So come back to the present and the present time you. And let me ask you, 0 to 10, how much pain do you feel? It was a 4 when we started?
To 0.
0. Great. Good job.
It's a 0, yeah. And then back of my neck is relaxed too.
Is relaxed.
Yeah.
Wonderful.
Thank
All right.
you.
Good job.
Thank you.